Great. So I will call to order the Board of Health meeting of Wednesday, November 2nd, 2022 at 6 p.m. First on our agenda this evening, we have two sets of minutes. The first set of minutes is from our meeting of September 13th of 2022. For this meeting, both Dina Costa and myself were both present. This was tabled from our last meeting. So, Dina, did you have an opportunity to review the minutes?
Yes.
Okay. So I will entertain a motion to approve the minutes of September 13th, 2022 as written.
Make the motion as stated.
Dina Costa, member, I second it.
Any discussion?
No.
Nope. With there being none, then I will call for the vote.
Dave Escobar, Vice Chair, abstain.
Dina Costa, member, yes.
Carrie Singer, Chair, yes. Minutes approved for September 13th of 2022. Next set of minutes are from our last meeting, and for this meeting, myself and Dave Escobar were present for that meeting. So did you guys have an opportunity to review the minutes as written?
Yes.
Yes, okay. So I will entertain a motion to approve the minutes of October 13th of 2022 as written.
Dave Escobar, Vice Chair, make the motion as stated.
Dina Costa, member, I second it.
All right, any additional discussion?
No.
Nope.
Nope, with there being none, then I will call for the vote.
Yes.
Dina Costa, member, I abstain.
Carrie Singer, Chair, yes. So minutes for October 13th, 2022 are approved. So we are caught up with our minutes. Thank you so much, Shane, for your putting those together. All right, so we have two local upgrade approvals or variance requests on our agenda this evening. The first one is for 235 Main Street at Cumberland Farms. It's a local upgrade requesting for equalization of tank to have 4 feet to cover.
So this is a big plan. Liz McCready, the designer, is here. It's really a simple request. The plan may be big, but the request should be fairly simple. The equalization tank, the request is to allow for 4 feet of cover instead of the 3 foot max that Title V requires. So to have more cover, it just requires the approval of the Board of Health.
What are we thinking about with why 3 versus 4? What are some things that we look at with this?
So Liz can jump in, but
Okay.
the main thing is up until that point you're using gravity. So based
Okay.
on where the sewer line's coming out,
Yep.
you want to use gravity. So it keeps needing to get deeper and deeper, and then it'll get pumped up. But that is the
So that 4
the
feet
main-
is a result of the distance of the tank from the facility?
So we have an elevation we had to work with coming out of the building, which went into the grease trap, into the septic tank, which goes to the equalization tank. Then we're pumping up after that, but like you said. But we have to maintain a grade in this area so that the water flows off. And that's the only tank that ends up being less than 3 feet below grade. And it is an H20 tank, which should make it structurally sound.
So the
And it
grade-
does have risers on the inlets and outlets, so it's
The grading,
accessible.
the runoff you're talking about is rainwater?
Yeah, or just the
or
overland
like
flow.
gravity, right? So like where the sewer line is
Well,
coming
I'm
out
just
your
wondering,
phone.
is it because you said you're pumping up at some point?
You were pumping up into the processor from there. So then now all the tanks come back up and we're closer to the finished grade. But for the equalization tank, it went from gravity down to this tank, then now we're,
Okay.
Yeah.
So it's the flow of the refuse into the tank, that's what's causing the 4 foot?
that's what's creating the elevation that it's at.
Okay.
And which puts it further, deeper in the ground than the septic tank, which gives it makes it deeper than 3 feet in the ground to the top of the tank.
Okay.
We tried to grade over that, the 3 feet would just have this divot.
Yeah,
Right?
so it's
So-
not, yeah.
Yep.
My eyeballs aren't working as much as they used to.
And then on the second page too, on the top, you'll see that profile of how the flow of like from the building to the grease trap to the tank. You have it. here and here, so you have a grease trap, so that's kind of in the kitchen
Yeah.
area, and then this is the septic tank, and then it goes into the equalization tank, so that's all gravity. And then
Okay.
from there, it's gonna get pumped into here.
So that's why
and
it's
then into
going
here, and then
downward.
pumped into this.
Okay.
Yep. So it just looks more complicated because it is a little bit more of a complex system.
Right, right. Did you want to take a closer look at this, Dina?
Oh, yeah.
Sorry, I just needed it like,
It's tiny.
I couldn't see like from that far over there.
There's a lot going on there.
Yeah, there's a lot going on there. But I see it now, what you're talking about, so.
So it's just one of
So
these.
this is the tank we're talking about, EQ tank.
Do you want to look at it?
Yep. Okay.
All right. Any other questions for Liz, the engineer?
I do not.
Is there still an open question about the Oxford regulations in addition to Title V?
You've said it, that they are in place, so
Yeah. So,
I'll believe you. Even though they're not online.
We'll get them posted.
Yeah.
Tomorrow, end of day tomorrow, check it, we'll have them up.
okay, so you're gonna review the Oxford regulations and make sure everything's,
Yeah, yeah, I have a couple
And
of
you've had a
things to
chance to
tweak.
review this?
I,
Yep.
I did, there's a couple comments, there's a couple things we're still going back and forth on, but
Okay.
Liz is aware of it, I have no concerns that,
Okay.
I have no concerns with the request and that the plan will be approved.
Okay.
Rika, is this more of a space issue when this happens more than anything?
It's really a gravity piece, right? Like where the sewer line is coming out of the building, and you
Okay.
have to have a certain slope. And because you're having so many tanks,
Okay,
right?
the
That's
tank,
also leading
okay.
to the
Yeah, I gotcha.
because you keep having to have a slope down.
Yep. So the size of the system too.
Yep.
Okay.
Yeah, if you look, there's like multiple
Yeah.
tanks. Yeah, so it took me a little bit to take a peek at it.
so when you're talking about the grease traps, are these existing things that you're tying into, or is this completely new? system?
It's all new.
Now, was there just one system there before? Because I know that there was a convenience store next door as well, so
Right, they both had systems.
they both had separate
Yeah,
systems, so
yeah.
both are being properly abandoned?
Yes.
And so, and then this will be a brand new system?
Yeah.
Okay. Because there was Cumberland Farms, there was another one here, and then
The
there
restaurant
was,
back here, right?
They're using.
it was,
Are they taking the one on the side too? I think so.
Everything will be.
everything's got, and
Yes.
plus the little, like, I don't want to call it a plaza, but like, there were like a few
Behind the
buildings.
Cumberland Farms.
Yeah. that's
There
the
was
restaurant.
there was a seafood
There's a
place
seafood
that
place.
Yeah,
has been
behind.
closed for a while.
Yeah,
Okay. All right.
yeah, that's gonna probably be.
Was there
you know,
a
the
system
building,
for that
the-
too?
The proposed building is gonna be more in place of where that was.
Yeah.
And, yeah, their system was off to the side, I think.
Okay.
But there's gonna be plenty excavated.
Oh, I'm sure.
Yeah.
Yeah. Okay. Well, just making sure with all the different systems, I just want to make sure that it's okay. Sounds good. Any other questions? All right. So I will entertain a motion to approve the local upgrade for 235 Main Street, Cumberland Farms, with plans drawn up by Liz Dupree, Clearwater Environmental, received on October 18th of 2022, to install the equalization tank with greater than 3 foot of cover, so it's going from 3 feet to 4 feet on the plans. And the local upgrade is documented there, and you have had a chance to review that.
And it's just pending the review of the Oxford.
The official approval. There's a couple minor
Yeah.
things
Okay.
that need to be added.
Okay.
Make the motion as stated. Dave Escobar, Vice Chair.
Dina Costa, member. I second it.
All right, any additional discussion?
No.
No.
Nope, but there being none, then I will call for the vote.
Dave Escobar, Vice Chair, yes.
Dina Costa, member. Yes.
Carrie Singer, Chair, yes, approved.
Thank you.
Thank you.
Thank
you.
you.
All right, next on our agenda, we have Leicester Street, multiple perk extension requests.
It's actually just one for right now.
Okay.
And you should have the packet, in your packet. And it's lot number 100, Leicester Street. Perk testing was done in 2017. Our regulations say the data's only good for 2 years, and so they want to use this data now to design the system, and so they're requesting extension. I have no concerns. The land has not been altered in any way, so based on Title V, the perk data should still be, the soil data should still be good. So, and we have the owner of the property here as well in case you have any questions.
Excuse me, Rena.
Can I just have you state your name? That would be great, thank you.
Daniel Proudy, Expedition Realty Trust, but just a correction, I'm the former owner. I sold it to Nova Group LLC.
Thank you.
Okay.
And then I discovered that I had overstayed my welcome. So I told them I would take care of it and
Okay.
forward all the paperwork. Now, I was just looking through my file. I guess it's a 3 to 4 minute perk, which is good, but I was multitasking the other day, and I just looked in the back. I had a copy of my check, and it said the town of Martin. So I've got to bring you another check.
Look at that. We didn't even catch that.
Hey, who knows? It's probably
Probably would've
already
at
been,
some
maybe it's
point.
already cleared.
Well, we thank you for your honesty. We'll look into that to
Well,
see.
hey, too much multitasking.
I'm sure.
Too many things going on at once.
I'm sure. Okay, and so as Rika said, there was no altering of the land at all?
No.
It's been stable since 2017?
Nothing's been touched. And,
Nothing's been touched?
They'll be going to tech review and going through the process shortly. They've, the engineering's being done, so you'll get a shot at the septic system when they figure out what they're building there.
Okay,
But it's a business property.
it's a business property?
Yeah.
Okay. Great. Do you guys have any questions for Mr. Proudy?
I do not.
Is it an empty, a vacant lot?
Yes.
Okay.
If you go up Leicester Street, Route 56, opposite the crane company and the road to the concrete company, there's a new building there. That was part of this parcel. I've got about over a mile of frontage. And it used to be residential, and I don't, years ago, it was going to be a big apartment development. And when that went south, and when it came out of bankruptcy, I bought it from Digital Credit Union. And I approached the planning board and I said, I'm in the industrial development business. I'm the guy that brought IPG and Wilson, all those people to town. Goya Foods is my client. But I get tired of telling the little guy I don't have an acre or two, for your small business. So the first one, of course, was TC Controls. And basically, I hope to get, 10 or 12 lots for small businesses like that. And then, of course, the sewer usage, it's nil. No washing machines, dishwashers, showers, so,
Okay.
so anyway.
Thank you.
So,
Okay. Sounds good. Any other questions?
No.
Good. All right. And there's no limit, Title V doesn't give us any limit in terms of how often, it's just a blanket that we can extend it, and it's up to the board's discretion.
So Title V says that any testing after 95, as long as there's no alteration, the soil data is good. Our regulations make
Okay.
it only good for 2 years and then would require an extension.
All
So
right.
it's from our regulations.
So it's from our regulations,
Yeah.
okay.
I'll be back with a few more that were perfect.
Okay,
It's the chicken or the egg, so.
okay. All right, sounds good. All right, so I will entertain a motion to approve one perk extension for, do we have an address on
Lot
it?
100.
Oh, Lot 100 Leicester Street in Oxford, from a perk soil testing that was completed on June of 2017. So we will approve for an extension on that.
Dave Escobar, Vice Chair. I make the motion as stated.
Dina Costa, member, I second it.
Any additional discussion?
No.
No.
Nope, with there being none, then I'll call for the vote.
Dave Escobar, Vice Chair, yes.
Dina Costa, member, yes.
Carrie Singer, chair, yes, approved.
Thank you.
Thank you.
I thought it was about 3 years ago, I started reading the paperwork, thinking it's about 5 years.
Time just flies, right?
You lose 2 years to
I'll see
COVID.
if I'll refresh the check, I'm sorry.
Do you want to check first to see if that check has cleared?
Yeah, we'll take a look, we'll double check, and then we'll give you a call.
You haven't handed it in yet? Okay.
Okay, I'll just
All right.
switch it out tomorrow.
Perfect. Thank
you.
you. Have a good night. All right. Perfect. Any other local upgrades or variances? We're good on those? All right. Next on our agenda, we have biological safety regulations.
So this might actually be pushed to the next one. So I have done some outreach, I just haven't heard back. So I do have a potential contact that I'm hoping will help. I've sent her an email and I'll be doing a follow-up call. So I have no updates from our last meeting. I don't know if you still want to discuss them or wait till I have additional feedback from people working in the field.
Okay. So have you guys had an opportunity to review the regulations? Do you have anything else to discuss or bring up for follow-up for our next meeting while we wait?
I haven't done anything.
Did you all discuss it at the last meeting? I
Yeah.
forgot to look in the minutes, okay.
Yes,
Where'd
we
you
did.
leave it?
So we basically picked up, so Dave reviewed what we had reviewed.
Yep.
We made a couple other minor changes from that after that was put together. I
yellow
think are those
here,
on
maybe?
there?
No, they're not. The biggest takeaway was to have a consultant or somebody that's in the field that has a better understanding
Yeah.
of biosafety, have them look at it and give their feedback. Because some of the comments were, is this wording appropriate? Should be worded a little bit differently,
Okay.
but maybe for their standards it is, or
Okay.
maybe
Like
they use
approved
different
procedures.
verbiage.
Approved by who?
Okay.
So, you know.
All right, so little things like that, which you're working on and, okay.
Yep. We did go through, because when we discussed it, we talked about doing a lot of links to the CDC
Oh, right.
and NIH. So that actually is all on there and it tightens
Awesome.
that up a lot,
Okay.
which I like a lot there, which is good.
Yeah, because we knew those might change over time and
yeah.
having the link would just be better, yeah.
Exactly. And then Dave and I, we kind of ended up talking a little bit more about the professional advisory,
Oh, right, okay.
that board there that we were talking about. And we had some additional discussion about who should be present on there and how
Okay.
often they should occur.
Okay.
So I believe that, Dina, when we talked about it at one meeting, we had said, when things significantly changed, then they would notify the board and we would have it. And then Dave felt that it should be irregardless, like at least on an
Once a year.
once a
At least once a
year,
year.
Minimum, okay.
just as a meeting. So
And then more frequently if there's any changes.
Great, that makes sense.
so I think we'll probably go back to that, and then of course pending professional review of it, for someone who knows.
Yeah.
So Bedford has a consultant they use to do inspections, and I have her contact information, and she's aware that I'll be reaching out. I haven't heard back from her, so I want to give her some time, but I'll be following up with a phone call to see if she has recommendations of who best to reach out to, or if she'd be willing to glance over them and give her feedback.
Okay.
And then I think we started to have a little bit more conversation about like the application process and the permitting and kind of tightening that language up as well, because it was like duplicated on one section and then into another section. So we kind of started talking about that, but then we were looking at all the different pieces that they have to submit, and we were like, well, what is that? And that's when we decided that it might be good to have someone with experience to really review
Yeah.
this.
Did we ever hear back if there was any interest or want for us to do the highest biosafety level?
So I think the idea was stick with three.
Stick with three.
1, 2,
Yeah.
3.
Does that make you feel better? Yeah, so I believe that was updated in here too.
Yes,
When,
yep.
we had that conversation and that was an update
Yeah.
from the last
I'm not
meeting.
saying we can't blaze the trail, but it'd be nice to have this under our hat. Yeah.
Yeah. I mean,
Swap
and if
before
that
we
ever
run, yeah.
happened, and someone had interest, then
True.
that's a bigger conversation and we can.
Yeah, and then these already exist. and
Exactly.
yeah.
Yep. And then we can kind of update it from there.
So this part, under general requirements C, meet on a routine basis as needed, that.
So that's gonna be changed to minimally once a year.
Okay.
Or more frequently as changes occur.
Okay.
All right. And then we started getting into the section, like D, where it repeated a lot of, application permitting stuff that was in section 7, so tried to consolidate some of that so that it wasn't so repetitive from one section to the other.
Okay.
And then within that same section, I think that's where we kind of, it's letter E, like the approved for BSL-3 containment, like who's approving it, so more clearly specifying, and then it's like, well, perhaps it would be better to
Yeah.
get some clarity overall.
And that's kind of where we left off.
Okay.
So,
All right.
did you have any questions after reviewing it?
Well, I just wonder too, like, kind of along the lines of what you talked about last time, would it be beneficial to like partner with another, I don't know, I mean, I don't know if we need any particular like consultant, but I mean, I guess if you already have a contact, that's a good thing, we could always reach out.
Or see someone that's in the field, right, that has some, like, we're putting these rights in place, we don't have a biotech company in town yet that could provide feedback
Yep.
on kind of like how they function, what type of
Right.
regulations benefit them, so having some review from somebody
Who
who
does,
does
yeah.
this, yeah.
Okay. All right.
So that's kind of where we left off.
Well, let us know what you hear.
Yeah, and I think that will make a difference in a lot of stuff. But I mean, we did make pretty good
Progress.
headway
Yeah.
on it, which was good. So I think if they can help us get through some of the institution piece here, like E, F, G, and then when we get into the permitting stuff, what is it that we're actually looking for from the town? And even some of that language, for them to be able to review as well. Right.
Okay.
I mean, we got 50% through.
Yeah.
That's good.
It was pretty good for us, so. All right. Any other questions, follow-ups, anything like that for Rika in terms of the biological safety regs?
No.
Not for me.
Otherwise, we'll revisit it
Yep.
next month, and hopefully we
Hopefully I'll
have.
more.
Yep,
Yeah.
okay, perfect. Sounds good. All right, very ahead of schedule, but next on the agenda, we have director's report out.
Yes. So just the general updates. I don't know if on Friday, the email I sent with the COVID wastewater numbers, they're still staying low, or lower, I should say, they're still high, but, so that's good. And our percent positivity, I got the email this afternoon, it's now at 7%, so that's good. We still have test kits though. If anybody needs test kits, we still have those, they're still good.
Okay, can I just interrupt you for 1
yep.
second? Are we posting the wastewater percentage and the positivity percentage on our website?
I don't think so. Would you like me to start posting them?
What do you guys think? I think it might be a good idea.
Why not?
I mean, COVID's still around. I don't want people to think that we're not still looking at it. And we were posting a lot of our rates and stuff. So I think it would be a good idea so that people still know that it's out there and that we are taking it seriously and continuing to look at it. So, do you?
I stopped receiving the.
Oh, yeah, from Kathy.
Yeah, that's okay, but I think it would be a good idea just so people are aware
That
and
we're still
maybe a
doing
blurb
some.
or something about what it means for the wastewater.
Yep.
Because I don't think that, the general public may know exactly what that means to them and what that percentage looks like, so.
And so I don't quite understand the pattern to it. I haven't looked too closely. So I get a couple reports every week, like on varying days. Should I post it like once a week, or every time I get one?
No, it's
Once a
once a
week?
week, yeah.
Okay.
No, it's fine. And then, is there, do we still have like a COVID section? I haven't been on in a while. Do we still have like a little COVID section? And do we put on there that there are test kits still available?
There is still a COVID section. It could probably use some updating. It should still have test kit information.
Okay.
But I should probably put the expiration extension, because I believe I put it once before,
Okay.
but they continue to be extended.
Okay. And about how many kids do we still have left?
We still have, I'd say, like 300 to 500.
Okay.
We still have plenty.
All right.
Yeah.
So maybe we can also post something on social media in case people
We-
want test kits. Is there any other place you guys can think of that we can hand some out?
We say housing.
You've been
Senior center.
Senior
Yeah.
center.
The senior center, we recently dropped some off. We do have some residents that come in, so we've had some events where we've handed them out. So like any events that we're at, we make sure to bring them. I mean, we've significantly depleted our
Yeah.
supply.
which is good.
And then we've gotten more and we've depleted that, so.
The schools, I think, is great. One of my kids actually got sent home, and this was at the beginning of the school year, and they sent my child home with one of our test kits. So it was like, here, if you want to test them. So, I mean, I think the schools are using them.
The schools might have their own.
Oh,
That
did they
might
get their
not-
own supply? Damn.
What about at I'm just trying to like think how to outreach just a little bit more to just let people know that, you know, because I think that there's a couple of events coming up that I saw at the high school. They're doing some sort of like craft fair or something. Plus there's football games and stuff. I'm wondering if that might be
I could also see if we can get it into isn't it a virtual backpack that gets sent home with the kids, right? With
Oh, yeah,
information,
yeah,
thing,
that's,
like if you need additional test kits,
you
can
would
reach
know
out to
about that.
us.
So
Electronic.
an electronic
Yep.
backpack, yep. Okay.
And then I'm sure,
You can reach out to the churches as well.
yes, and the food pantry,
Yeah.
because they're
That
all
would be
connected
good.
to that too,
Good spot.
food shelf.
Have we left some at the food shelf?
I have in the past, I have not in a while.
Maybe that might be a good
Yeah.
spot to maybe leave
Especially with the
some.
holidays coming up.
Yeah.
Yeah.
They
People
can
might
put it.
wanna
And
test
then
before they.
I'm sure Oxford Housing can, to all their residents, they can send out a message as well.
Mm-hmm.
Okay.
Okay. All right. Just
That's
trying to
great.
think of. I hate to have them go to waste.
No, and I
So
don't
I'm
want
trying to
them
think of like.
And they'll
ways
still
that
be
we
good
can-
for a while, but I agree, get them out.
Yeah. Yeah. That we can do that, but
Are we continuing to receive more on a regular basis?
Nope.
So that's over?
I mean, I don't know if it's over. We could be getting
Who
another
knows?
email in like a week or two, right?
Okay.
The state might have still a lot that they're trying to get rid of, and so with the holidays, they might see if communities need additional. I haven't heard that, but that could happen.
okay. All right. Sounds good. I didn't mean to interrupt
No,
you,
no,
but
no, I
before
appreciate that. Before we
before we
forget
jumped
that.
on. Yep.
Yeah, because that was basically the COVID update, but as our two nurses probably know, RSV numbers are on the rise, particularly infants and children. And so we did get a notice from the state today, right, recommending to our residents, you should get your flu and COVID vaccines to practice good hand hygiene. Hand washing is critical. Cover coughs and sneezes. If you're a child or you aren't feeling well, you should stay home, right? For COVID, RSV, make sure you stay at home and then clean those high-touch surfaces. So we are aware that those numbers are going up. I think, and Worcester just announced that they recommend masking because the numbers are of
Yeah.
RSV. So it's something to keep an eye out for.
And do we have info on that as well on our site?
No.
So I
And
would
the state
probably
hasn't
add
sent
that just because it
anything.
has been out there and I've been seeing it a lot more. It's even with adults, yeah, I know. I know, it was awful.
And I heard there's a vaccine in the works,
Oh, really?
an RSV vaccine.
From Pfizer, right? Yeah. Yep.
We're just gonna be all vaccinated up.
And then our regional community health coordinator started last Monday, and I had a call with her today. She came from the town of Auburn, so that was good. I had a great conversation with her today. She's going to continue to work on the community health assessment. She's also really interested in trying to find grants that we can apply to as a region, get additional funding. So it'd be really good to have that. And she's going to help with a couple of more challenging housing cases that we have, connecting individuals to resources. So it'll be I hope a big help to have her do the outreach, find like what might be available for certain residents that need it.
Okay.
And our other shared staff, regional inspector, public health nurse, FB, kind of status quo there, still doing great things, helping us a lot. Regional inspector, he's continuing to increase his inspections, food, septic, kind of as needed. And the nurse and Effie are also, they put together some flyers recently on Lyme disease, because Amy had noted that it seems like our numbers have gone up, and it just is this time of year you're seeing more Lyme cases.
And so that's been typical for Oxford for as long as I've been on the board, which has been many years. We've always seen an increase in Lyme disease for some reason. So I'm glad that we're doing
Yeah.
some information on that. And we had posted stuff years ago. And then, of course, COVID hit, so that kind of took over Lyme disease. So, but yeah, that was definitely something that,
And it was nice because Amy being new to us, she was like, I'm seeing numbers increase, so the epi went back and she pulled the numbers from past years from Oxford, but also our neighboring communities, right? And there tends to be this spike at
Yeah.
this time, and it's not just Oxford, so.
Okay.
That, it was interesting. to
yeah, it
have
is
that,
interesting
too.
because we've never had that level of detail other than you have 3 positive Lyme cases in town. Okay, like where's the data, other
Right.
data to go with it? So
they've
that's
been
great.
helpful.
Okay.
And then regarding the shared services, we had to do that capacity assessment. So I submitted the final document request today. I hope that's it, but we'll see if they come back for more. But hopefully, I'm curious to see what they find for our region, for like if we get more resources, what's going to end up happening. And they seem to be moving pretty quick, so hopefully we'll have something soon. And then as I noted at our last meeting, the housing code has been updated, will go into effect in April. There's a virtual training this month, and then there'll be in-person trainings, I'm assuming in the new year at some point, that we'll all be attending to get comfortable with the changes. Especially because Paul Hoffman from the Community Sanitation Program, he's now retired, but they brought him back to help with this, and he was a big part in making the changes, and he made sure that all the numbers were different, that none of the numbers are the same, so that people actually read the code. So it'll be a fun challenge for us.
That was smart. Okay.
And then you might have heard, I just want to give an update. On Monday morning, there was a tractor trailer rollover on 395. It was a refrigerated vehicle. So got the call nice and early from dispatch, and it was headed to a Walmart in Maine, and so all the product was discarded.
Okay.
And then...
Did you arrive on site or did you make the call?
I made the call. They sent. I got up. I asked. It was the deputy chief. I spoke with him. He sent me pictures, updated me. I was in contact with the towing company because it took about
It took a
12
long time.
hours to get it.
It was awful.
To get because they got the dumpsters on site on 395, filled them with. It was all yogurt. Fill it with the yogurt. And then dispose of it. I got pictures of it. I have all the slips, the invoices, everything. So it's all been properly disposed of.
Lobsters.
Luckily,
No lobsters.
I've been hearing that story from all sorts of people
Yeah.
from all over the state.
Or potatoes. I've gotten called out for potatoes.
Oh, really?
Yeah. Tractor trailer, yeah. It wasn't, so it was a tractor trailer truck that buckled on 395 headed to Lay's, and it was filled with potatoes. So- Yep, I got that call and went out for that one, so. But, I think some of them are cut and dry, like this one's cut and dry, but if you ever get that call and you're at home and you can't make it, I mean, feel free and one of us can always, we're available to go out and actually see it, but that seemed like it was a pretty
It was, yeah.
it was pretty cut and dry. I mean, it took over the whole highway,
Yeah.
so
Yep, and I got pictures of it.
there was no
and-
saving the yogurts.
And it was the fact that it was refrigerated, the truck
Okay.
split a little bit the seams, right? So now you're not having that product refrigerated anymore.
Yeah.
I saw the interior, it was
Okay.
it all needed to be discarded.
Okay.
And luckily no major injuries. So
Okay,
that
good.
was also
Thanks for doing that.
Yes, thank
yeah.
you.
Of course, part of the job. It was a nice start to my Monday morning.
Mine too, I had to drive in the traffic.
Oh
It's
yeah,
all
that's
traffic.
yeah.
I took the back way. I got on and got immediately back
You
off.
got on and got off? Yeah, you're smart.
Yeah.
And then lastly, we're working to improve our permitting system. So hopefully we'll have a little bit better flow in the next couple months. We'll see how long it takes.
Okay.
And then yes.
Oh, yeah. So, the permitting system, is it like upgrades from where we're at?
Yep, so we're hoping it'll be a little bit more simplified. I'm working with the
Okay.
building commissioner.
Okay.
Trying to make make it a little bit easier.
Okay.
And my goal is that we can eventually, and like I said, it'll take a few months to get there, but that there's a chance that all of you could become end users in the sense that rather than physically having to sign, you can just check the box that you've reviewed it and approved it.
Okay.
Because I know there was concern about like having your copy of your
Signature.
signature, but if you can at least then just like log in and give
Okay.
your okay, that'll
That would be nice.
simplify it.
Yeah, that
So,
would be really nice.
that's the goal.
And it will be hopefully easier for the consumers to utilize,
That's
correct?
the hope
Okay.
as well. Yep.
Good.
And then my last update, just to keep you aware, Green Tea Massage is under new ownership, new business name. So the state will be doing an inspection and issuing a massage therapy license to the owner. So police and myself will continue to keep an eye on
Okay.
it. And if they do any body works, we'll make sure that they get properly permitted.
Okay.
Right now, they're saying it's just going to be massage, so that does not fall under our jurisdiction. But we will be monitoring it.
Okay. And the state they'll obviously receive all the paperwork in order
They
to
already
properly-
have, and they've notified us that they will be issuing a permit and they will be conducting an inspection in the coming weeks. And they'll let us know when that inspection is, because I know police would like to be out as well, and I'll probably
Yeah.
go out as well.
Okay. All right.
Those are my updates, and just about the next Board of Health meeting, we currently have that scheduled for December 7th, so that's the first Wednesday in December, but then starting in January, it'll be the second Wednesday at 6 p.m., but here as well. In December, it'll be here as well at 6, and then in January, it'll be the second Wednesday at 6, and also
Okay.
here.
All right. And those times, now that we're coming up to it really fast, I know that we had done a lot of discussion about moving it and making sure that it worked with our schedules, in particular with Dina, because I know that your schedule fluctuates. So you're good?
I am good.
Starting in January. All right, awesome. And that hopefully will alleviate our meeting from interfering with town meeting and all those other things, so that we don't have to cancel again, like move it and try to find a convenient time. So we'll see how that works out for us.
So December 7th, and then the January meeting, the second Wednesday would be the 11th.
Yep, the 11th, and then February 8th and March 8th.
Okay. Alright, sounds good. Any other report?
I have nothing else. Any other questions for me or anything else that you'd like me to look into or do?
Any questions for Rika?
Nope.
Thank you.
All right, thank you very much. All right, under miscellaneous, we have permit reviews. Do we have any?
Only one?
We
Let me
won.
write
Take your
that.
time and really sign that, I know.
But we're coming up on some permit renewals end of December, so you'll be having.
Which one's, tobacco, I was gonna say. Oh, God.
Dollars, yeah.
Oh, yes, that'll be another big,
Pretty much everything, so.
pretty much everything, except food.
Yeah.
Food kind of does its own thing, so, which is fine. Gotta spread the wealth. Can you imagine if both were done together?
I'd have a hand cramp after that one.
Get a rubber stamp.
Yeah.
Signature.
All right, wonderful.
Yeah.
All righty. Any other questions or final thoughts or comments to Rico or Shane while we're here?
No.
Nope. All right. With that being said, then I will entertain a motion to adjourn the Board of Health meeting at 6:40 p.m.
Dave Escobar, Vice Chair, I make the motion as stated.
Dina Costa, member, I second it.
Any discussion?
No.
No.
Nope. There being none, call for vote.
Dave Escobar, Vice Chair, yes.
Dina Costa, member, yes.
Carrie Singer, Chair. Yes. Meeting adjourned. Have a great night, everyone.